All right. Good morning, everyone, and thank you so much for joining us for Talk Tuesday. Good morning, Latasha. Good morning, Erica. Nice to see you all. Hi, Juan.
Good morning.
Nice to see you. Hi, Angelo. Thank you all for being here. It's hard to believe we're already into the end of October, getting close. So thank you for joining us on this beautiful sunny fall day. I am Caroline Calhoun. I work here at Ed Advance in the northwest corner. I'm coming to you from Litchfield, and I am joined by my colleagues Jason and Devana, who will be helping us with all things back-end tech support this morning. And we are also very happy to be joined by Lisa Daymonde and Vanessa Hudson from DCF, who are here to share all sorts of relevant and interesting information with you all today to help support your attendance and engagement work. And we are joined by Jay Brown from the Bureau of Special Education. Thank you so much, Jay, for being here. And as everybody rolls in and we get started this morning, we'd love for you to introduce yourself in the chat, share your name, your district, your role, and maybe a little something about what you're hoping to learn today about how DCF can partner with districts and support our schools and families, because that's what it's all about. So thank you all for being here, and go ahead and drop those notes in the chat for us as we get started. Let's go ahead and go to the next slide, please. Thank you, Jason. So we wanted to start with some exciting information from CSDE. In case you have not already seen this news, Performance Matters Forum has opened registration. They are scheduled to hold their conference on November 7th. It's at the Hartford Convention Center again this year. And that's going to be an 8 o'clock to 1 o'clock conference. It is free, but attendees do need to register by Friday, October 24th. That's this Friday. So we've linked the registration form there for you. And this year's conference has a whole variety of sessions. Those of you who have been to it before know that this is a really helpful day. There are lots of different topics focused on how we can improve student learning outcomes. So there will be sessions about assessment, attendance, MTSS, college and career readiness, a whole variety of things, multilingual learning, school climate, all those things that really keep the work moving forward for us on the ground in schools and districts. So we encourage you to register for that. I do believe our LEAP leadership team and Kari Sullivan-Custer will be presenting a session all about attendance and highlighting the work of our partner district, Manchester. Latasha is on this morning, so thank you so much for that. So we encourage you to come to the conference, and if you are so inclined, to join our session. Let's go to the next slide, please. So the next piece we wanted to highlight for you this morning is that CSDE has announced what is really exciting. It's this first ever statewide list of industry recognized credentials for our high school learners. So this is the first time the state has created this sort of comprehensive list, and it includes more than 300 validated, what they call IRCs, or industry recognized credentials. So this is really exciting because it connects the classroom learning with those real world learning opportunities that our high schoolers are looking for. And it really shows proof of workforce skills that hold value beyond the high school experience. And it's really a tangible goal for students to be working toward during their time in high school. So when we think about this through the lens of attendance and engagement, oftentimes secondary is such a tricky sticking point when it comes to chronic absence. So when we can think about how students might be more engaged during their high school experience, this is a really excellent opportunity. And I've linked there for you the CSDE press release, but there are informational webinars coming up this week and next week. Thank you to Jay for curating all of this information for us, but we encourage you to attend those so you can learn more about this. There are sort of targeted audiences for each of those informational webinars, but anybody is welcome to join each session. So really interesting work happening at the state as we think about how to meet the needs of our secondary learners. Let's go to the next slide, please, Jason. All right, so Attendance Works has this really interesting new collaboration with Schoolhouse Connection, and they were funded by the Imagine Learning Foundation. And researchers dug in to really think about what's working for our students who might be experiencing homelessness. So, for those of you who might be McKinney-Vento liaisons on the call or who are working with populations where we have students who are experiencing unstable housing, this project really highlighted some powerful quotes from students on what really helped them and what didn't when they were trying to attend school while experiencing homelessness. So we've linked those quotes for you. They were really enlightening. There's also a summary of some successful strategies for improving attendance for this group of students who we know are at risk. And there's also an action planning template I linked there to help schools assess and strengthen their efforts when it comes to identification and data and all things related to this group of students. Next slide, please. Another really wonderful research effort was just published through the Search Institute, and there's an article called 6 Shifts for Better Family Engagement. So as we keep family engagement front and center in all of the attendance work that we do, not surprisingly, the research showed that richer school family partnerships really don't just start with invitations. Instead, they sort of grow over time through these 6 relationship-centered shifts, including things like honoring our family's strengths, building mutual trust. And when I look through this list of 6 shifts, it's really not novel or anything new, but it is a good reminder for us about sort of this baseline of those best practice principles when we work with our families, thinking about their strengths, their resilience, thinking about how we deepen our relationships with families as we get our students to show up to school. So that is linked there for you to dig in if you'd like to get into the research a little bit further. Next slide, please. EdTrust, some of you might be familiar with them, another great organization. They have reviewed over 23 education websites across the US to really evaluate the different attendance data systems and policies in place, as well as what investment strategies are happening around the country, and the discipline and policies and practices and how all of that ties into attendance and engagement. So they published a new report about how different states are handling chronic absenteeism, and there are some really interesting nuggets of information in there. So we encourage you to dig into that resource as well. Next slide, please. I think I shared this with you the last couple of weeks, but just to iterate, the RESC Alliance is offering for the first time, we have a new MTSS task force. So we are offering a session for you that is all related to MTSS and attendance on November 3rd. So we encourage you to sign up for that. We've also linked for you there the other offerings and how to register for that particular session. Next slide, please. So the last sort of nugget of information I wanted to share with you all this morning comes from our October 6th Marshall memo. And this was a really broad and long study that was done by researchers out of England. And they were really studying student school absences across the country. And their findings showed, not surprisingly, that absences at every level of schooling are detrimental to students' academic achievement. They also noted in their research that the absences that fell at transition points and in secondary schools were actually the most detrimental to students' track and path for success. And they found that absences in that very first year of primary school was one of the strongest predictors of later achievement. So this is a lot of information that can help us in our messaging to families about, the sort of misunderstanding that oh, an absence in pre-K or an absence in kindergarten doesn't matter. It's just pre-K, it's just kindergarten. And this is yet another example of research that really proves that attendance and engagement from the earliest years is really critical for students. So I have linked there for you the research journal where this was published, and you're welcome to dig in further. It also just iterates for us that this is not chronic absenteeism, a problem that is singular to Connecticut, much less the United States. It really is an international problem. So I thought this information was useful to share with you this morning. Next slide, please, Jason. As always, our LEAP Home Visit Hub through CREC and our colleague Nushet Black-Burke has our LEAP 101 trainings that everybody is welcome to attend. The next one is coming up on November 12th, so we encourage you to register for that. Everything is free. You do not have to be a LEAP funded district to attend, and it just gets into all of those cornerstones and the philosophy of building those relationships, keeping family engagement front and center, and we hope you show up to those trainings. Next slide, please. As always, Connecticut resources linked for you. Kari always wants to make sure that you have easy access at your fingertips, links to things like the EdSite data portal, and all of the excellent resources that CSDE has put together for folks. All right, next slide, please. So that is all of the information I have for everyone this morning. I am excited to introduce to you next our colleagues Lisa Daymonde and Vanessa Hudson. Lisa has dedicated her entire 36-year career to the Department of Children and Families. That is quite a remarkable number of years, Lisa. And for 11 years, she's been an integral part of the DCF Careline. And throughout her tenure, she has really served in a whole variety of roles, beginning her career as a social worker and then advancing through numerous other leadership positions across multiple locations around the state of Connecticut. So Lisa has extensive experience in this, and we are so lucky to have her joining us today. So thank you, Lisa. And we also are joined by Vanessa Hudson, who has devoted nearly 26 years to the Department of Children and Families, including 17 years at the DCF Careline. And in Vanessa's current role as a program supervisor, she works alongside 3 fellow program supervisors to manage the reporting call center and all the after-hours investigations into reports across Connecticut. So we are so fortunate to have both of you with us this morning doing the hard work across the state of Connecticut, and we appreciate your expertise. So I am going to turn it over to both of you, and I believe as you all go through your presentation, folks, you are more than welcome to drop questions into the chat as we go, and Lisa and Vanessa will field those questions in real time as we move through their content. So Lisa and Vanessa.
Great, thank you so much, and I'm very happy to be here with all of you today. I already do see some questions, and I was trying to make notes to myself, so I'm hoping that I believe we're going to be answering them throughout our conversation today, but if I do miss something specifically, keep putting it in the chat, and we'll keep checking. Next slide, please. So for today's agenda, we're going to focus on DCF, talking about strategic goals and our Careline description, letting you know what the Careline is all about and how we do our work. We're going to present some data information around our call volume and report information. We're going to talk about mandated reporter laws and the revisions that came out in July 1st of 2024. We're going to also talk about seeking supports, community and family supports, JRBs, YSBs, our fatherhood work, and our DCF outposted staff. And last, we're going to talk about, not last, probably one of the more important things, our reports to DCF. Vanessa, I did see, and don't let me forget, when we get to some of those slides, one of the questions was really about what happens when a report comes in, if we could talk a little bit about that. So next slide, please. So DCF has statutory mandates and we have strategic goals. Our mandates are child protection, children's mental health and substance use, and prevention. Our vision is to partner, or our mission statement is partnering with communities and empowering families to raise resilient children who thrive. We have 6 goals: safety, which is first and foremost in what we do, and assessing our focus on vulnerable populations; permanency, making sure that we're achieving permanency for children and families; our racial justice work, it's to eliminate racial and ethnic disparities and outcomes at our department; child and family well-being. So it's really assessing the entire family, not just the child, but the whole family well-being, a holistic approach. Our workforce, it's really to engage our workforce through an organizational culture of mutual support. So it's making sure that our workforce feels supported and trained, and that we're providing that support and guidance to them. And last, but certainly not least, is our emphasis on prevention. How do we help families to avoid them coming to our attention, right? So that's our work those are our 6 goals, and that's one of the most recent ones was the prevention one that was added. Next slide, please. So the Careline. The Careline, and many of you know this already, we're a 24/7 operation, right? We have 126 staff. We're a call center. We're responsible for the SIU Special Investigation Unit, and that unit is responsible for investigating our employees, our foster parents, our congregate care settings. They also conduct legislative, if we get a report on a legislator or someone in government, as well as police departments. So if a report comes in on a police officer, our special investigation unit would be assigned that report. EPIU, Educational Professional Unit, Investigation Unit. That's the unit that conducts all the investigations on school employees where in their professional role there's an allegation of abuse and neglect. They also are involved in transportation companies, particularly those that we identify as working for the school, right? Those are your contracted bus companies. And they do daycare and camps investigations. We have what we also call our CPS background check unit. And when I say background check unit, it's not criminal background checks, but it's CPS background checks. So SDE, hiring new employees, will do a request for a CPS background check on all school employees. It comes through that unit. We probably receive well over 200,000 requests a year. And we have an after hours response. So Careline doesn't sleep. 24/7, 365 holidays, we are always working. When DCF is closed, Careline is still operating. So we have an after hours response. So if calls come in after hours that require an immediate response, we send staff out to begin and commence an investigation. Next slide, please. I wanted to show this slide. So this slide is our call volume, okay? Now, you're looking at all these numbers like, oh, wow, like what does all this mean, right? So monthly inbound calls are answered, abandoned, and caller disconnected. So that's our monthly, that's what we get in our calls. Total answered calls, and we have 3 queues: a general queue, a hospital queue, and a police queue. The police and hospital get first priority in our queue. So if somebody calls from the police department on the police line or hospital line, they get bumped up from the general queue. We have a total abandoned and total disconnected, monthly abandoned and monthly caller disconnected, and online reports. Basically, the difference between the abandoned and disconnected is when a caller gets disconnected, those are individuals that come in to our phone system, they don't wait to get into the queue, and they hang up. That's a disconnect. Abandoned are calls where people come in and are get into the queue and are waiting and hang up. So those are what we call abandoned calls. That doesn't mean a callback. So if someone's on a call and waiting to get in and they select a callback, that's not an abandoned, that's a regular call. If you look way over to the far right at online reports, we completed about 14,000 in 2024. We're steadily going up. So the online reporting portal, we've definitely seen an increase. When you look over and it says improper 180, those might be things that got into the system that shouldn't have gone in. And as an online report, it doesn't mean that somebody did something wrong. So basically, total answered inbound calls and completed online reports for 2024 were 88,181. Now, last time I talked to the group, we had an all-time high in 2023. We're starting to now see a stabilization of the numbers. So it's coming down a little bit. But 2023 was an absolute all-time high. 2024, a little bit lower. And I'm not quite sure where we're at for 2025, but I'm guessing it's about the same as 2024, maybe a little bit lower. Next slide. So the next few slides are really just focusing on data, and you'll have this in the PowerPoint, so I won't go into too much detail on every single area, but if you look at total calls and total reports, you can see, like I just discussed a second ago, which was all-time high in 2023 to now we're starting to level off again. Total reports for 2024 were 65,000. Previous year was 68. So we've begun to sort of like, start to trend downward a little bit. Mandated reporters make up 86% of all our reports, okay? The highest mandated reporter are the schools, and I'll show you that in 1 second. Next slide. I like to show this slide really for everybody to look at the trends, right? So if you see like June, July, August, June, school is coming to a close. We're still kind of up there in our volume, but it's starting to come down. July and August, schools aren't in session. So we have a lower number of reports that come in. September kicks off, we start to go up. October up, November up, December a little bit down. Why? School's off for about a week. So we lose about a week during that month, so it's a little bit lower. And then if you look over and go back to January, February, March, I always say March Madness. I always attribute it to basketball. Don't know why, but I do. And it really is our peak of our year in reporting. You see a little bit of dip in April, and you see it kind of back up again in May as school's getting ready to close in another month. So that's sort of the trend. That's been that way for my entire time at the Careline and probably my entire career at DCF. Next slide. So our acceptance rate. So while we may have 60,000+ reports, we accept 46.5% in 2024 and 46.3% in 2023. It's about the same. We average about 45, 46% annually in the number of reports that we accept. Next slide. This slide I wanted again to show you. So schools make up the most reports from mandated reporters. Why? You're all with kids, students, 8 hours or more in a day, depending upon after school activities. So a long time during the day, you're with the students. They feel comfortable, they talk to you, they see you, they engage with you, you know them better than anybody else. So schools are our top mandated reporter at about 35, 37%. Police are second, followed by mental health, followed by hospital. During COVID, as you can imagine, school wasn't in session and schools became, I think, our second top reporter. But presently, and how it's always been, schools make up the most of our mandated reporter reports. Next slide. So this is just some highlights, right? Things I've already talked about, but it gives you a brief summary of all those slides. So while we saw, like, if you look at May, our busiest month, August, like you saw, our acceptance rate highest is in August, lowest is in September. Like, so I gave you some trend information in this slide. And next slide, please. Now I'm going to turn it over to Vanessa.
Thank you. I was just chatting with Laura Beth Rodriguez, and I'd love to chat more to make sure that I answered your question the way that you were asking. I'm gonna, sorry, hold on 1 second. I just lost, the PowerPoint. I'm sorry, I don't see it, but
You don't see it?
no, I'm not sure why. I think I hit a button. So hold on one second. No, I don't know why I don't see the PowerPoint. But I was going to talk a little bit about the mandated reporter law revisions. That this will be a bit of a repeat from last year if you were in attendance. So it's a great chance to just learn some more information about this, or if you are new this year to hear these mandated reporter law revisions.
Hold on, Vanessa. Next slide, please.
Thank you. I don't know why I don't see the slide on my screen. So we wanted to talk about the preliminary inquiries. This was a change in July of 2024. The law now allows for mandated reporters, such as yourselves, the school employees, any health professionals and coaches, to conduct a preliminary inquiry to determine if there's reasonable cause to make a report to DCF. So what's really important to understand is that this inquiry is not an investigation by the school staff. It's not meant to be, we hear a lot where mandated reporters are saying, well, we don't want to ask too many questions. We don't want to investigate. It's not an investigation. It's just the school employees trying to get additional information to determine if you should make a report to DCF. And it helps also DCF when you're reporting information to DCF, for DCF, our screeners at the Careline, to determine if there's enough information to accept a report. We also want to point out that if you do a preliminary inquiry and you determine that you don't really feel like there's enough to make a report in good faith, you are immune from any liability or criminal or civil actions. So what that means, really, to boil it down, is if you feel that there's no need to make a report to DCF based on the information that you've gathered, in good faith, you're protected from, like we've all heard the terms, failing to report to DCF. Next slide, please. Oh, I think people are talking to me, telling me how I can see it, but I'll just continue on. So preliminary inquiries, like I said, are not considered investigations. I kind of already touched on this, that it allows you as educators to ask questions about who, what, where, and when, and just to seek clarity. And it helps you to determine if you need to make a report to DCF, like I said when I was talking in the last slide. It's crucial to ask questions that are sensitive and non-threatening and designed to gather information without leading the child. And it's important to remember that the goal is to gather information without making the child feel pressured or scared. Next slide, please. So here's some tips for educators. When you're conducting these preliminary inquiries, you can create a safe environment, make sure that the child feels comfortable and secure, use open-ended questions. This allows the child to provide more detailed answers, and just be patient and listen. Give them time to express themselves. No need to rush when you're talking with them, and reassure them, let them know they're not in any trouble. It's okay to talk, and observe your any nonverbal cues. Sometimes nonverbal cues paint a whole picture. So just pay attention to their body language and any behaviors that they're exhibiting.
Vanessa, can you, one of the questions in the chat was really, can you give some questions?
Some questions to ask, yeah.
Yes.
For example, when you have a child who indicated that I have a better example. You're viewing a child and you see that they have, let's say, an injury maybe to the eye, and you don't really have any disclosure as to what happened. A lot of times, depending on your school district, you might send the child to the nurse or to the school social worker. But if you're a school social worker, a nurse, or the teacher, speak with them privately, and you can ask, hey, what happened? Open-ended question. And any open-ended questions that you ask may lead to either a disclosure, or you might find out a disclosure of abuse or neglect, meaning they may say, my father hit me. But you might also find out that the child was hit by, in playing outside playing football with kids. So you want to ask open-ended questions about, well, what happened? And then if you do start to get a disclosure, you definitely want to ask some questions around how they are feeling about maybe returning back to that environment if there's a concern of abuse or neglect at home. You want to ask, if questions around whether or not they feel afraid to return home. So you can ask, like, how are you feeling about returning home? How are you feeling seeing, you wouldn't use this word, but perpetrator, but how would you feel about seeing your dad after you just learned that the father may have hit the child? So it's important for us as DCF, because when we're starting to determine response time, if we've already determined that we're going to accept the report for investigation, we want to find out, where's the child going? Is the child going to be with the perpetrator? Is the child maybe going to the other parent's house, who's maybe a non-offending caregiver? So you want to find out, more about that information. I hope that answers your question.
I think it did. I think I see a heart.
Okay.
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 All right.
Next slide. I'm not sure.
I think it's me.
Okay, good. Thank you. I'm going to try to play with this and see if I can see if this works.
It's the roadmap. Okay. Well, we put this slide in because we really wanted to talk to everybody about seeking support is a sign of strength and how to really engage with families, like Vanessa had talked about. Before you make a report, did you ask the questions? Do you have enough reasonable cause to suspect that a child's been abused or neglected, or have you engaged with the family to make connections for the family to avoid a report to DCF? So this is the roadmap that provides you with a lot of information, right? So identified need, right? What's one of the first things we want to hook families up with? Faith-based organization. Favor. We're going to talk about that in another slide in a few minutes. Is it appropriate to do a youth services bureau or juvenile review board referral? Well, I missed the United Way. United Way. Johnny's needs a coat. Can you connect the family with 211? Can they help with that? Johnny needs maybe a mobile psychiatric service. I'm gonna call 211 to access that for Johnny. So it's just really thinking about all these other avenues before making a report to us. Substance use access line. You suspect that a child is using something, right? And maybe that's the connection that you make with the family. Connecting to careconnecticut.org, Director of Communities Based Supports. So it's providing additional supports for families. We have a contract provider, Careline Behavioral Health, where they do in-home and evidence-based intervention. They have a community pathway where you can get families connected. Intensive care coordination, access to mental health for youth. The number is on this PowerPoint. We still have what we call voluntary care management. And voluntary care management is for those of you that have been around a while, know that we had voluntary services in the past that where DCF would open up a voluntary services case for a child with a DSM diagnosis and would connect families to voluntary services. We now contract with Careline to do that. However, the Careline, the 800 number that's on there, is the Careline, and we will process the application for Careline. I know, confusing. Careline. But we will process that application for voluntary care management for Careline. It gets sent to Careline once that's made. It's typically made by the parent. So if you have a parent in your office and you have a child with identified DSM diagnosis and could really benefit from some service, and I'm not talking, we're just going to go right to residential care. It's really about providing kids with services in their homes while they're living with their families. That's what we want to try to get them connected with so that they can have that support. You would do it with the parent and they could request voluntary care management. Careline will assign somebody and then work with the family and make some connections. And last but not least is the Careline. And the Careline is about abuse and neglect, child safety and child maltreatment. So, many times everybody thinks like, DCF is the Child Protective Service system. We're only an agency and we're part of a larger system. All these things on this map are the larger system, right? So that's what we wanted really to impress upon everybody. We're about to go into talking about some more services in a second, but I do want to answer a couple of the questions that I saw. I did see a question in here about connecting, like, for example, working with DCF and partnering with DCF when there's an open case, right? Whenever there's an open case on a family, our jobs at DCF are really to make sure we're making connections with collateral providers, right? That is calling and talking to the school with a permission to treat, a permission, a release of information from the parent. We will call the school, talk to the school about Johnny, find out what's going on, how can we best support the family, etc. So we will partner and work with the schools. We should be, right? If you're the reporter that's made the report on the family, we should be calling you. We should be calling you to talk to you about the report. We should be calling to talk to you about how we can help the family best, and support the family. So we should make those connections. I will at some, not today, I'll have to put it together, give you, Caroline, an opportunity to send out to everybody, all the office directors in the offices, so that you also have an additional connection to an office, that if you can't reach a worker or a supervisor or a program supervisor, you can go right to the office director in that particular office if you're looking for additional support or connection. Next slide. I really want to make sure that I can't stress enough that we need to be engaging with families, and in families, it doesn't mean the moms. We need to be engaging with the dads. Many times I find out that, ask the child. Maybe the mother's not going to give you the father's name, but the kid will probably tell you, hey, my dad is so-and-so. And it's really about, making sure that we're not forgetting about dads, that we're also engaging with dads, because they are a support to their families, and they do play a crucial role in their children's lives. And it's really essential that when you're gathering information about ready to make a report to us, we need that information. We need as much information as possible when you're providing an oral or an online report. Next slide. I think this is the services stuff, right, Vanessa? Yeah.
Yes. So we already touched on favor in the roadmap that Lisa went over 2 slides ago, but we really wanted to plug favor. You should have the PowerPoint in the chat, so you can access this website and take a look at what they have to offer. But they provide services for medical, mental health, emotional, and behavioral health challenges. I shouldn't say they provide services, but they'll kind of give you assistance and show you where to go to get services for these families, and refer this link to the families as well, who are able to access the internet and kind of are savvy enough to look through, but obviously assist them as well. But it's a great resource that we have been working with at DCF. Next slide, please. So also another service, another community provider who's a great resource for schools would be the Youth Service Bureaus and the Juvenile Review Boards. So a little bit about the Youth Service Bureaus. There are 101 Youth Service Bureaus serving 137 communities across Connecticut. They are the coordinating unit of community-based services. So they are your go-to. The funding, an issue though, funding of course varies widely across Connecticut. Therefore, availability of services varies as well, but they do provide services for ages birth to 18. And for those students who have excessive absenteeism and truancy, YSBs are your place to go. So you definitely want to refer to the YSBs. The Connecticut Youth Service Association, that's the website. They are, if you go on their website, you can find out what your YSB is for your area. Some of them are regional and they might cover several towns, but you can look up your town and determine who your YSB is. And there's referral forms on there, and it's a great tool. It's a great can be a great community partnership. And it's really, if your school has not established a relationship with your YSBs, please, it's a great relationship. I used to be on the JRB and a YSB in East Hartford, and the partnership is amazing if you know, to be able to collaborate for these students. The JRBs, they are reserved for behaviors that did or may result in an arrest. There's a restorative process designed to help repair harm and restore relationships. The entire process is done collaboratively with the youth and the family, and obviously the community. It's not appropriate for truancy referrals. So your YSBs is where to go for your absenteeism and your truancy referrals. Next slide.
Can you repeat that? I'm sorry.
Sure. Which part? The whole slide?
About the truancy.
So for truancy, if you have students who have excessive absenteeism and truancy, that your YSB is the way to go. You want to refer to the YSBs and communicate, get in touch with the YSBs for services. The JRBs, that's not an appropriate referral for truancy or excessive absenteeism. Okay. And we'll touch on this in a second, but DCF also is not an appropriate referral for truancy as well. However, excessive absenteeism may be. So we'll touch on that in a little bit. Next slide. So we wanted another great resource. One slide back is outposting in the community. We DCF have several outposted staff in many different areas in the community. You might have some in your school systems. We have DCF workers who work out of school systems. We have DCF workers who work out of police departments and community-based programs like child guidance clinics and other community-based sites. They are assigned as a liaison between DCF and the community. They interact with the community and community partners on behalf of DCF. And next slide. It's a great resource for you as school as school staff. Even if you don't have someone within your school or someone who maybe not assigned to your school, if you have one at the police department, feel free to reach out to them. They are for the community. They'll do consultations, which of course they'll provide guidance that promote better outcomes for children and family. They'll consult on mandated reporting. DCF, you can run a case by them and say, do you think this is appropriate for a DCF referral? Or should we refer to services first, or, hold off and see, depending on what the situation is. They will provide consultation. They'll also give you access to resources that'll help raise awareness of local resources and services. They'll assist with access and service referrals, and they'll offer support to children and families. It's a great partnership. It helps DCF assist others in guiding on navigating through the child welfare system. And they also offer mandated reporter training. So as you all know, because I'm sure all of you have already gone through a mandated reporter training, you can do the mandated reporter training online. However, if you prefer to have someone one-on-one, not one-on-one, let me say that differently. If you prefer to have someone in person, so it could be a little bit more engaging, you can ask questions. They will come out to where you are in your community. They'll come out to your school system. If you have, a professional development day and you want to have them come and speak for a portion of it, that is something that DCF offers. So that is done through the Training Academy, the Academy for Workforce Development. You can go onto their website with DCF, and you can request a mandated reporter training through there. Or again, you can also speak with your outposted staff member if you have one, and they will set that up for you. Next slide. Oh, and I just wanted to add one more thing is we do have a list of the outposted staff that is slightly outdated that we're asking for them to update because we've had a lot of movement within DCF. So once we get that, we will share with the group so that it can be disseminated.
Thank you, Vanessa. I was going to jump in and just make sure we said that to everybody. I wanted to include it in this presentation, but when I looked at it, I was like, oh, I think it needs to get updated. I don't want to give you something that's outdated. So I will make sure, Caroline, that we get that to you guys as soon as we can. Okay. All right. So I see a lot of stuff in the chat around making reports to the Careline or making reports to DCF, you know, after exhausting all of your efforts around chronic absenteeism situations. So, and I feel your frustration or your maybe desperation and like, what do we do with the kids? How do we engage them? How do we get them back into coming to school on a regular basis and things like that? I think you're all doing a lot of good things first before you're calling us. And I'm hoping that some of the things that we've showed you today that you can get access to refer families to. But, you know, when it comes to educational neglect criteria, right? We try to focus on or look at 2 age groups, right? You know, kindergarten or young kids to age 12. That excessive absenteeism may be indicative of the parents or caregivers' failure to meet their educational needs. And for kids that are older, excessive absenteeism coupled with a failure by a parent or caregiver to engage to improve a child's attendance may be indicative of educational neglect. Those are the 2 things that we use when reports are called in. We're also looking at finding out what efforts you've made to address the issue, what the patterns have been. If it's the same pattern from last year, and last year they had, I don't know, 50 absences, this year they now have 50 again, and you're feeling like it's a chronic issue, it's really outlining what are all those things that you've done so far to engage. And yet, despite all those things, Johnny, who's age 10, is not coming to school, right? But the considerations that we really look at in addition to that are looking at age of child, health, level of functioning, academic standing, dependency on a parent, right? And then, you know, some of the other characteristics that we look at are, you know, rationale provided for the absences. Do the explanations make sense? Efforts to communicate and engage with the educational provider. What efforts have you made to engage with the family and work with the family? And failure to enroll a child in school would be educational neglect. I'm hoping that today will help a little bit. We've given you some more information, some contact information at the end, my information as well as Vanessa's, that you could always reach out and run some of these situations by us. If you're really struggling with trying to figure out, like, should I make another report? Is DCF going to take it? What is DCF going to do? So what do we do when we accept a report, right? When we accept a report, first thing we do is call the reporter back, try to get some additional information. Meet with the family, see the child, talk to the child, do interviews with the child alone, interview all family members, ask about supports, find out who dad is, talk with dad, talk about those supports to the family, and really try to assess, like, these are the allegations and how do we get Johnny back to school, or how do we make sure that children are safe? So hopefully that'll continue to answer some of these questions for you. Vanessa, did you see any other questions that stuck out that I might have missed? Okay.
I'm trying to respond to some in the
Okay.
chat.
Okay, great.
Oh.
I strongly encourage everybody, if you haven't taken it in a while, take the mandated reporter training. That'll give you some additional information around physical neglect, physical abuse, and those types of situations that you would report. Next slide. Okay, Vanessa, this is yours. I'm going to turn this over to you to talk about the 2 ways to report. Oh, the one thing I do want to say is you're probably hearing, I'm calling the Careline. I'm on hold for an extended period of time. You're right. It's happening. We just converted over to a new system on August 7th, I think it was, to a new computer system that has created a backlog in wait time. So we are working really hard to learn our new system so that we could take calls much quicker and process reports quicker, the oral report, including the even online report, because the online reports have a different priority than the calls, because calls are intended to be emergent situations and on-calls are non-emergent. So please be patient with us.
Thank you for
Vanessa?
saying that, Lisa. So for the oral and the online portal reports, here's some information that you would want to ensure that you have ready. If you don't have it all, and it's okay, but try to have as much of it as you can. You want to know the names and the addresses of the child and or children and his or her parents or other persons responsible for their care. And the age of the child. If you know the date of birth, that's great. And this slide, I know you guys are school employees, so you probably have all of that right in your database. Some people call us and they don't have any of this information, but you guys have a lot of this. The gender of the child, the nature and the extent of the child's injury or injuries or maltreatment or neglect, the approximate date that an incident may have happened, and information regarding any previous possible injuries that you're aware of to the child victim or to their siblings. Next slide. You also would want to try to convey the circumstances in which the injuries occurred. Or I'm sorry, I didn't, the circumstances in which the injuries may have become known to you as the reporter, and the name of the person who you suspect or the child may have disclosed to be responsible for causing an injury. The reasons such persons are suspecting of causing such injury of or maltreatment or neglect, and any information concerning any prior cases that you're aware of regarding abuse or neglect. And then whatever action, if any, was taken to treat, provide shelter or otherwise to assist the child. Next slide. So if there's two ways to make a report. The preferred method would be this link that you see here. It's our mandated reporter portal for non-emergent situations. And I'll talk a little bit in a second about what non-emergent is, but this is how you get to the portal. You can even, I mean, this slide is it breaks it down, but you can even just type into a Google regular search engine Connecticut DCF mandated reporter portal. Next slide. But again, if you follow these steps, it'll bring you to this link here, and you can click on that link. And then next slide shows you exactly where our portal is. But again, if you just type in DCF Connecticut Mandated Reporter Portal, it'll bring you right to this page here. You would want to select the middle selection, because the left is for, we talked earlier, Lisa touched on what our CPS background check unit is, conducting employment checks and what have you. You don't want that portal. The portal all the way to the right is our Capta Cara newborn notification portal, where hospitals and other birthing centers make reports regarding newborns. So you wouldn't want that one. You want the middle one. It's the mandated reporter online reporting portal. It's a very long sentence there, for non-emergent matters. Next slide. And so it brings you to this slide. It brings you to this page, and you have to sign in with an ID Me account. You would, if you don't have one, you can create one. And once you go through to ID Me, it'll bring you right to the portal, and you would answer the questions that I pretty much laid out to you as the things that you would need to know when you're either calling or you want to file an online report. A little plug about online reports. If you are doing an oral report, you have to fill out a DCF 136 form. If you are doing an online report, you do not need to fill out a DCF 136. And it'll say that at the end. For those of you who have completed one already, there's like a little pop-up that says you do not need to complete a DCF 136. So just wanted to let you know that. Next slide. These are what constitutes emergent concerns and reasons why you should not make a report through our online portal. So if you have an emergent concern, you want to call our 1-800 number that's listed here. So these, again, are reasons why you should not and cannot, because it gives you a stopgap, you cannot make a report through our portal if the child is suffering from immediate harm, or if the child is in need of emergent medical or mental health care, or the child or you, quite frankly, as the reporter, if there's an expression of realistic fear of further abuse or neglect within the next 24 hours, or if it's believed that the child and the family will be inaccessible within the next 24 hours. For example, if you've heard that they're going to flee the state, because that happens. So these are the reasons, like I said, why you should and cannot make a report through the portal. And the
Vanessa, can you just add a little bit about like the dashboard,
Sure.
ability to start it, go back, finish it, kind of a thing? If you could.
Sure. So with the portal, we've had, I'm calling it enhancements. So I think it was actually, we're going on, maybe it's been some time now since we've had these enhancements, but we're still very excited about it. So we now have the ability, you can start a report, and let's say you get pulled away and you can't finish it because you have to respond to a situation at your school. You have up to 12 hours to go back to the report in your dashboard and finish it and send it off to us. And it goes it goes straight to a portal. Many of you who have been around for a while, it used to be an email. That's no longer. It now just goes straight to a portal and it ends up in our kind of dashboard at DCF. You are able to have a one-time opportunity to print. So a lot of schools have called and said, hey, I can't print it. I need it for the records, for the child's record. Unfortunately, for right now, you have one time to be able to print. So once you complete it, it says, do you want to print it? Print it then. Unfortunately, you can't go back. Trying to remember what other things were enhancements, Lisa, if you can remember. I'm sorry.
No, I think that was, I mean, I think we added some, we rephrased some of the questions. I can't stress enough that one word answers, it's not enough to put on an online report. We need as much detail as possible because we're being left with trying to make a decision whether we can accept, or in some situations, you don't have enough information, you non-accept. Or you don't have enough information and you accept because it's sort of borderline, but if you had more information, you might not have. So just being as detailed as possible is imperative in how we make an assessment of whether to accept or not accept.
Yes, thank you for that, Lisa. And I also in the chat saw some discussion about educational neglect reports to DCF, and some of them have not been accepted. And what I would say is definitely, like Lisa was just saying, provide as much information as possible. Make sure if your school district allows for it, make sure you're doing your home visits, contacting the parents, finding out from the parent, why is the child not attending school? Is it a truancy issue where it's a 15-year-old who's just refusing to go to school, but the parent is trying to engage the child and work with the school? Or is it, a 6-year-old who the parent is just not getting to school? And you know that a 6-year-old it's different behaviors than a 15-year-old refusing to go to school. So you want to put in as much information as possible. So one thing I'll bring up too, something I just thought of for that online mandated reporter, but also when you're on the phone with one of our screeners making an oral report, you can provide us with attendance records. So there's an ability to do attachments in the portal. You can upload the school attendance records to there, or when you're on the phone with our screener, you can email her or him the attendance records or fax if you feel more comfortable with that. But that's also very helpful.
That's great, Vanessa. I
Yeah.
forgot about that part.
Yeah. Yeah. It's also very helpful for us to be able to make an assessment. So I don't know. I know that I lost track of the chat because I've been talking, so I haven't been able to read. I see there's 10 new, but I think a lot of them had to do with truancy and educational neglect. So feel free if anybody, I think Lisa, if you want to talk about the next slide.
Yep. Next slide, please. Thank you. So this brochure is Empowering Mandated Reporter brochure, and you can access it by going to scan the download. And it will just give you some additional information about child vulnerability, how we assess for safety. It just gives you a whole host of other information, including our operational definitions. So please feel free to make sure you take a look at that. Next slide. And this is our contact information. I see we're running running close to the end of the time. This is our information that you can reach out to us. What we forgot to do is put in our email address. So we will make sure that Caroline can share that with you as well, so that you have our email addresses. We certainly can be available to help. I'm trying to look at the chat.
There was a question in the chat about inaccessible, including a weekend. It was from Kristen and somebody else. They were asking for clarification around that.
I can answer that because I just read that. You were asking if it's just that if you're worried that DCF can't get in touch with them. That's correct. It's not if over a weekend we won't be able to reach them. It is if you feel they're going to flee, or, you know, we're not going to know where they are after you make the report. I hope that answers it.
Excellent. We are at 11 o'clock. I want to thank you both, Lisa and Vanessa, so very much. I know this is a complex and nuanced and heavy topic, and we so appreciate your expertise and your support and the partnership you offer to all of our school districts. And thank you to all of those who are on the call. I know that navigating DCF and when to call and not to call can feel pretty challenging. So we really appreciate all of the support you are offering your families, your students, and the lengths you are going to do everything in your power before potentially reaching out to DCF, while knowing that that is an amazing resource that we have at our disposal. So thank you to everybody so very much. Jason, I just have one last slide, if we can go to that. And this is just to remind you all, our next Talk Tuesday is November 4th. We have a discussion on tap for everybody around school safety, mental health, and crisis response. So we hope that we will see you on November 4th, and we will push out the materials that Lisa and Vanessa noted about director information and contacts so that everybody has that at their fingertips. So thank you everybody for joining us, and I hope you have a wonderful rest of your Tuesday. Thanks again, Lisa and Vanessa. Take care, everyone.
Thank you, everybody.